Are we set to go?
I think everyone is, or is everyone in yet? Oh, they are. Okay, perfect. Well, hi everyone. Good afternoon. So sorry we were having some technical difficulties, but it wouldn't be a virtual conference if there weren't some troubles going on. So this is IC 75, custom molded seating options, innovations in COVID-19. And we'll get started right away. Everyone, please be on mute and send your messages to the chat and we'll answer those towards the end. So take it away, Jill.
Okay, well, welcome. And again, I apologize for the technical difficulties. I thought I had this foolproof, but apparently not. So as a quick intro, I'm an OT. I've been in practice for about 40 years now. I had a private practice, and now because of some life changes, I had to become an employee for the obvious benefits. I have no financial disclosures to bring up. I'm just a therapist running a wheelchair clinic at a large residential facility for medically complex and fragile individuals with intellectual disabilities. So this course, my one disclaimer is that it was really designed to be in person. The ultimate goal was to have manufacturer samples, or at least the ability to go to the expo hall to see what we're talking about today. So next. Our course objectives, we're going to talk about or know 4 different manufacturers of custom molded seating, describe 4 steps in the custom molded seating process, match features of a custom molded option with clinical needs through the provision of a case study. Instead of a case study, I thought we would just do this throughout our discussion. And then identify the necessary steps to sanitize and clean a shape capture system to ensure cleanliness. Okay, next slide. So what are we talking about today? We are talking about custom molded seating that requires a series of steps. It has to include a shape simulation in some type of simulator, a data capture of the molded shape by some means that is going to be sent to the manufacturer, manufacturing of the cushion through the use of the data from the shape capture, and then obviously the fitting. So what we're talking about is indirect molding. Each step in this process is vital to the success of the system. The cushion is only as good as the weakest part. The simulation, the data capture, and there are many steps of the manufacturing process where issues can come up. The fitting part we're not going to discuss today, but it can make or break a successful outcome. Next slide. In the manufacturing process, I've simplified it because it is incredibly complex. Once the manufacturer receives the data that you provide, the cushion is designed. So that's a person, a computer system that is taking that data and creating the overall shape and contour of the cushion. It's reliant on a properly filled out order form for dimensions and specific features and options. The manufacturing aspect is actually the production of the cushion. And again, it takes a lot of effort to create each one because it is custom and they're making one of a kind. And then in the manufacturing process, there's a quality assurance phase that's imperative to make sure the final product meets the specifications noted on the order form. Okay, next slide. So what are we not talking about today? We're not talking about pricing of any type. There's too many variables and that can take days and days. We're not talking about custom made cushions. A custom made cushion might be a PRM precision fit that customizes absolutely every aspect of that cushion, but there's no simulation. It might be a PIN.dot custom basic, or it might be something that's made by a local supplier that makes custom made cushions. If it does not have a simulation and a data capture, we're not going to be discussing it today. We're also not going to talk about direct molding, which is the foam in place concept, where you are actually molding the cushion right around the person who's going to be using it. Okay, next slide. So there is a lot more to the process than what we've just kind of looked at briefly. And consideration for the use of custom molded seated is needed throughout the evaluation process. I get really frustrated because everyone says, well, it's a last ditch effort. It's too time consuming. It takes so much effort. And when nothing else works, then you go to custom molded. That's not what we should be doing. We should be considering it as an option throughout the whole process. Sometimes we need to view it as a better option, because if a ready-made option is okay, could we do a better job and a better service to our client by doing a custom molded option? That gets into the whole correction versus accommodation debate that we also are not going to discuss today. Next slide. So why do we use custom molded seating? These are just some of the reasons that I use them. The provision of intimate contact and support. It controls and impacts skeletal alignment, can provide offloading or total contact for pressure management and redistribution. That's important to know because some manufacturers have both of those options available. We often think of it as needed for the consumer who presents with the need for imposed external support, correction of reducible asymmetries, as well as accommodation of non-reducible asymmetries. So what's the difference between offloading and total contact? It's exactly what it says it is. If you have a client with a really prominent bony deformity or bony prominence, offloading is going to eliminate contact over that region, whereas total contact might provide contact, but the provision of total contact increases the amount of surface area that is absorbing the pressure. Okay, next slide. So the manufacturers that we are talking about today include Certified Adaptive, PRM, PinDot Contour U, as well as PinDot Silhouette, and then Ride Design. I've used all of these but Certified Adaptive, and I had reached out to them, and then COVID hit and I was unable to let people in my facility, so I have not had the pleasure of using their product or working with them. I figure it's kind of one of the many limitations that COVID has imposed upon us. What I try to do when I'm deciding and debating between which specific manufacturer I should use is look at the unique features of my clients and then best match those to the features of the manufacturers. I might do a full system. I might do a PRM seat and back for somebody, or I might do a Contour U seat and a Ride Design back. So I mix a lot. There are no rules and no really right or wrong. Okay, next slide, please. So here are just some options. Notice how similar they can be, but how different they can be too. The upper left is a Ride Design, a more minimalist system, versus some of the others that are a little more involved. Each manufacturer has unique or different features. It might be the feel of the foam, the type of the covering fabric, the seat to back junction. All of those options will help you decide what you need for your client at that time. Okay, next. So comparisons, many similarities, many commonalities, but what I've noticed over time is that each manufacturer has unique nuances and subtleties that really can be specific to help someone over maybe another manufacturer not offering that. It might be the feel of the foam and the combination of the cover. It might be the manufacturing process where you can get different foams layered instead of just one type of foam. So there's a lot of little things that you have to learn about these products. So what I tend to do is I rely on manufacturers' reps for a lot of information. And I also rely on my ATPs, my suppliers, who have more knowledge in these areas than what I do. Okay, next. So in the handouts, there should be a chart. It's a pretty basic chart. And printed out, it's 2 pages. It kind of looks like this. And we're just going to we're going to kind of review the different areas that we looked at to try to get an apples to apples comparison of these different manufacturers. So with sizes, what I found interesting is that all the manufacturers can really make any sizes that you need. There's common sizes that are preferred, and some much smaller sizes you might have to call for more information, and some larger sizes there might be an upcharge for. So all manufacturers have their exceptions, and what I have to remember is that we're talking about custom. So there aren't strict hard rules. And with most of the things, when I sent out questionnaires to the manufacturers, I got a lot of, it depends, or we can do this, but call us if you need something different. So I found that that was the common thread. And then it dawned on me that's because it is custom that we're talking about. So sizes can be, sorry, my phone just rang to add more chaos to my day. And I just lost my screen. And now I'm going to need some help getting my PowerPoint back so I can see. This is weird. This has been doing this to me.
So
sorry about this.
No worries. Okay, continue.
Okay, so all manufacturers have set sizes, but they all say they can all do a variety of sizes. Again, the beauty of customization and custom wheelchair cushions is that they are truly custom. Okay, let's go on. So it leads me to talk about use with children and others. I didn't know how to phrase this because you've got the small and then you have the bariatric population. And I get a lot of questions from suppliers as well as other clinicians as to why do you use this with children? And it makes so much sense in my mind. Common characteristics of children who can benefit from custom molded seating often display linear growth versus width growth. I have kids that stay the same width in their hips for a long time, but their height might increase by several inches in the course of a year. I can build some growth into these types of seating systems. I also need to be aware of how long any type of seating can accommodate growth. If you've got a seating system that can accommodate 3 to 4 years of growth, chances are, in my mind, that seating is not going to fit well and do what I really need it to do for that whole life expectancy. So with custom molded, I know I can get good fit long term. Again, we determine this at the time of the evaluation, keeping in mind that custom molded seating is designed to control skeletal asymmetries. So let's think about the other extreme in the bariatric patient. If there is a lot of tissue present, are you able to truly control that skeletal system within that tissue? Maybe not. Maybe though, you need to do a custom molded seat to help contain cushion or tissue to allow that person to be supported in the manner that they're comfortable. So it brings into my mind a lot of questions as to when I use it and when I don't use it. I don't hesitate to use custom molded seating with all ages, from my little toddlers up to my older folks that are now, you know, folks with intellectual disabilities who are in their 60s and 70s. Because if it's the best way to provide the skeletal support that they need, that's what I need to do. Okay, next slide. Cushion thickness was another question that I asked. You know, what is the maximum thickness you can do? Contrarieu told me it was 12-inch. You can have a total height of a cushion or total depth 12 inches. Silhouette 7, certified adaptive 10, Ride Design said 8 inches, but call if you need something more. PRM said we have no limit. So again, there's a lot of variables, and because it's custom, they can make exactly what you need. I asked what the minimum thickness was, which is from the lowest or deepest point within the shape to the bottom or the back of the cushion. And that ranged from anywhere from over like 1.5 inches to, depending on the needs and considerations. So that led to, let's go to the next slide. That led to the next question of what's your maximum depth you can get from the back of the shape to the front of where you want support. So the overall depth of the cushion is going to equal the total thickness minus the minimum thickness equals the depth of the supports that are available. So say with Contrarieu, it's 12-inch maximum depth or height of a cushion. You need 1.5 inches of minimal thickness. So that gives you 10.5 inches. PRM has been able to do significantly more than that. But again, it's because that's how their manufacturing process allows. Why is this maximum depth important? If you look at the girl on the left side, she has such a pronounced posterior rib hump, and then she collapses as you move anteriorly following the red arrow. If I don't provide her with support and intimate contact to support that up, I'm not going to keep her trunk in an upright position. So I need to make sure that my maximum depth is going to be able to provide that for her. Now, the other thing you need to be aware of is if you want something that's really, really deep, does that extra depth actually do something beneficial? Does it make contact with the client? For the most part, if it doesn't make contact with the client, I'm not sure if I need it. Except, and there's always exceptions, I had a woman who wanted an extended left lateral thoracic support because she was able to rest her elbow on that while brushing her teeth. And without that elbow support, she was unable to do that task independently. So by all means, I'm going to provide her with what she needs. And the custom nature of these cushions allowed that to happen. Okay, next slide. So shape capture process. Like we talked about, the seating that we're talking about today requires the use of some type of simulator or device. It can be freestanding, it can be a separate simulator. Ride Design offers bags that are inserted into the person's existing wheelchair. So you're actually getting them within their current base so you know what your parameters are going to be. The shape capture process used to be very specific to manufacturers. Now it's very cloudy, I'm finding. Most all of them can use any of the simulators that are available on the market. Okay, next slide, please. So once you have the shape capture completed, you have to capture the data. This is manufacturer specific and most are proprietary, whereas you can't use the iPad program for PinDot to capture a shape for PRM because they don't have the ability to open the file that it's going to be created in. We've come a long way since the days of fat plaster and foam in place. That was replaced with digitizing with this huge apparatus and a computer. And now we have, in my mind, an iPad with magic wands, and it does a better job. So most of these manufacturers I found through this questionnaire can still take plaster or foam in place molds and receive those, then they scan it and then can generate the cushions from it. So just because you don't have a data capture system does not mean you can't benefit from using these products. Okay, next slide, please. Manufacturing process, there are two different types for custom molded seating that we're talking about. Poured foam, which is the photo on the right, that is a pulled shape that is going to have the foam inserted into it. And the foam then they're going to pull it out of that vat. And what you see that covering is the back side of the vinyl that is actually going to make the front side of the cushion. The bottom picture is an example of a carved foam. These are done with big foam carvers. And each manufacturer has their own type of carver, and their program is fed with the data is fed into it, and the cushion magically appears. Okay, next slide. So foam types. This I got quite a different response for. Everyone has their own very specific types of foam. Certified Adaptive has ortho foam, memory foam, hyper dry, and combinations, whereas Ride Design has a closed cell, AccuSoft, and polyurethane. So it's funny, I got a lot of technical words back from them. So bottom line, it's what makes their specific cushion unique to them. This is one area that I really focus on because each foam has a specific feel. I might want a fairly soft foam cushion with a lot of shape and contour for some individuals, but I might not want that for others. You know, for example, if I have a client with a lot of muscle tone and athetoid tendencies, I want something firmer underneath them and behind them. So for that reason, I'm going to pick a manufacturer that can provide me with that feel. This factor probably helps me make recommendations more than all of the other factors. And what I've had to do over the years is I've had sample cushions. I've asked manufacturers rep for foam boards. PRM has a great foam board that their reps carry with them sometimes. And sometimes if I'm just not sure, it's like, oh, my rep is Julie, can you drop off the foam board? I need a refresher. I need to feel how they feel instead of just you telling me how they feel. So it's a great way to help identify which specific seating option you might go with. Okay, next slide. A lot of these manufacturers have the ability to use different foams and create layered foams that are in the ultimate shape that you've wanted. Overlays are offered by most manufacturers and can be over the general shape, or you sometimes can pick and choose the base layer, the middle layer, the top layer, and then the coverings. The coverings can make or break a seat cushion and a back too. You have to be very careful what you select. We'll talk about that in a few more minutes. Okay, next. Foam firmness. So don't confuse firmness with density. Firmness is merely how much of foam compression compresses when pressure is applied to it. There are standardized measures to do this, and you get a number and it becomes very technical. Density is nothing more than the weight of the foam. So you see people go up to foam cushions and push on and say, well, how dense is it? Well, density doesn't deal with firmness and softness. Density is just a weight. But each manufacturer, you need to know what the density of their foam is, because it might add overall weight to someone's system. So if you have someone who is able to propel but fatigues easily or has some shoulder issues, I probably, even though they might benefit from a Contour U vinyl covered cushion, that's going to be a very heavy cushion compared to a Ride Design or maybe a certified adaptive or a Silhouette, PennDOT by Silhouette. So the firmness and the feel and the weight of the foam can also be definitely a factor in how you make a decision down the road. Okay, next slide. Moisture protection. This isn't so much a benefit, a true benefit for the consumer, but it is a protection for the cushion that can impact that consumer's experience. It's the barrier between the consumer and the actual material of the cushion that provides protection for the cushion. We all know what happens when liquid sits on foam. It tends to absorb for the most part, unless it's a closed cell foam. These manufacturers have had to come up with ways to provide a water resistant ability in order to protect the foam. Sometimes it is with different surfaces, spray or different substances sprayed onto the surface. Or it might be the additional cover of a water resistant or waterproof, like mini cover, you know, that you would put inside the cover. Okay, next slide. Cushion coverings. Again, this is another area that I look at because I want to make sure that my ultimate covering is going to interface with the client to their benefit. In the old days, we used to have vinyl, Polartec, or fleece. That was pretty much it. Sometimes Lycra. Now there's all sorts of different fabrics. And what you have to be aware of is if you have deep, large shapes, you're going to need something that has multi-directional stretch to allow that person to immerse into the shape of that cushion. We don't want to cover to hammock, so they're not getting the full benefit of the custom molded surface. The spacer mesh fabrics are great for allowing some air circulation. And again, each manufacturer has unique options, and these options often influence how I choose which manufacturer to use. I don't worry about colors because I'm more concerned with the features and the functionality as opposed to the colors. I do have some parents that colors are very important, so then we do talk about putting them in certain types of cushions because of that. Okay, next slide. Trial fits. A trial fit is the ability to ensure proper fit and support of the cushion prior to completion of that cushion. So the manufacturer gets it to a point where they then send it back to the supplier installs it in the wheelchair, or you do it on a mat table, you simulate, make sure that the person fits in it. At that point, if you need to carve some foam out, you can. If you need to add some foam in places, you can. And so it can be a nice feature, but please be aware that it adds on time to the delivery process, and it adds additional shipping costs to the supplier. So if someone is in a hurry, I'm maybe not going to do a trial fit. Certified Adaptive, PRM, and Ride Design are all willing to do trial fits. Silhouette and Contour U, because of their manufacturing process, they are unable to. It's not that I don't use them because of that. And in fact, I use very few trial fits, but I have colleagues that use trial fits all the time because they want to make sure that it gets done properly. So it can eliminate the need for a complete remake in the long run for the manufacturer and the supplier. Okay, next slide. The ability to modify the final cushion. I asked this question of the manufacturers just because I was curious. I've always felt that if I do a really good shape in my shape capture and the manufacturer provides exactly what I have ordered, I should be pretty good. However, there are some times where things change in between that shape capture process and the delivery. And sometimes we can't control those changes. So I asked, at delivery, with a completed cushion, are you able to modify the shapes and contours and the dimensions? Everyone said yes, that they were able to do that, or that you would be able to do that in the field. But you have to be careful. If you have a vinyl covered cushion and all of a sudden you need a different contour to the surface of that, you're going to be cutting into the vinyl and you're going to impact the integrity of that seat cushion. With non-vinyl covered, you're able to do that, but you might impact the integrity of the cushion by cutting into the water resistant covering, although there are ways around that. And those are the little hints that your manufacturer's reps can give you. So let's look at the next slide. It's just simply an example. On the right is a Ride Design who we're looking at that cushion from the front, and you can see on the far right side where it looks like it's been carved out. And I did have to do that because a girl lost some weight, and as she sat in it, she was sinking too far down in it. Now all of a sudden she was experiencing some pressure on her, what would be her left greater trochanter. So by modifying that shape just enough, we were able to alleviate that pressure. The Contour U vinyl cushion on the other side, another right greater trochanter problem. He was getting some redness. I had no choice. I needed to make a modification, and just by taking off that small area of the vinyl, the problem resolved itself. Now I'm fortunate that I have a lot of extra covers that I could just pull out a cover that fit well enough. I had to modify it. I have a sewing machine at work, so I'm able to do that. And you don't know that there's a hole in the vinyl, but I did seriously impact the integrity of that seat cushion. On the other hand, it works really well for him. I'm not going to ask for a remake or for a manufacturer's revision just because it's still working and it's still meeting his needs. Okay, next slide. Specific options in cushions. I asked the manufacturers, what can you do in addition to just giving us the shape? And we asked specifically about soft spots, which is an area that is embedded into the shape of the cushion itself and filled with some other material, maybe a different type of foam. A recess, which would be, oh, I'm so sorry, my dogs are barking. The people across the street decided today would be just the perfect day to put in a new foundation for a house. A recess would be an area that is cut out and that another piece of equipment would fit in, like row cells or a gel pad. We also, I asked about additional padding, which can be added. Reinforcement of lateral cushion aspects. So if you have a deepened lateral thoracic support that is a little flimsy. Is there any way to reinforce that? All the manufacturers said, yes, we can do all of this, as well as overlays, which looks at using different types and thicknesses and firmnesses of foam layers to be added over the actual cushion. Okay, next slide. So problem solving and remake policy. With custom molded, if you don't get it right the first time, you have to have some way to find resolution to make it work. And what I found interesting was all of the manufacturers were, please call us. Please call us. If you have a problem, call us. Let us know what's going on. Everyone said, case by case, we will work with you to get it right, because we don't want our cushions not meeting the needs of the people who are using them. Some have time frames as to where they will help. I've kind of learned that most of them will help at a lot of varying times, depending on what caused the situation. So if I have someone who, after 9 months, isn't fitting well in a system, but I realize that they've gained 30 pounds in that 9 months, that's not on the manufacturer to remedy. That's on me to maybe try to get funding again for a change in medical condition. So I have to be aware of why there might be an issue, and then make sure that I'm asking the manufacturer to provide a solution for something that maybe is more their fault, but not something unrelated to why that cushion doesn't work at this point. I hope that makes sense. What I really liked was everyone was willing to offer problem-solving opportunities to remedy ill-fitting cushions. I found that really humbling to a point, because the manufacturers have to make money in order to survive, but they also truly care to make sure that the people that are sitting on their products are getting what they need. Okay, next slide. Timeframes. I know that we're in a bad time to discuss timeframes. I know some manufacturers towards the end of the year got behind. So these are averages and what they strive for. So Certified Adaptive says that they ship within 3 weeks of receiving the information. PRM is 7 to 10 days. PINDOT might be 17 days for Contour U and 10 days for Silhouette. Ride Designs, 12 days, often less. But keep in mind, there are so many variables involved. And these are general guidelines that the manufacturers report. But also know that if you have a supplier who is really crazy busy and they can't get out because they don't have a day available to do a delivery, that adds on to the delivery time. That's not the manufacturer's fault. It's nobody's fault, because it's how life seems to be going these days. Also know that if order volume increases, delivery times will increase. So at the end of the year, when everyone was trying to get all of this stuff done on the same insurance year, times backed up, and we saw this over and over in my clinic. Okay, next. So it's funny, when I created this proposal for submission to ISS this year, there was so much unknown about COVID. And I would talk to colleagues and say, oh, we're not going to do any custom molded because we don't want to get that close to people. And, our clients don't want us that close to them. But I started thinking, it's not fair to not provide the recommendations and the equipment that would provide the best benefit for someone based on the risk of someone maybe getting COVID. And what I've learned over time is that the use of proper PPE really can make a big difference. I saw numerous people, residents at my facility who were COVID positive that we would usually find out after we did a shape capture that, oh yeah, by the way, so-and-so is positive. And I have now exposed the seating team to that, and I have to make those calls. None of us got sick, but we all had on our proper PPE. And I think that it kind of, this is the way of the future. I have a few more years until my retirement, and I know I will never see a resident and another client without wearing a face mask of some type the rest of my career, which is sad to me, but it's what we need to do to keep everyone healthy. I think the vaccination status, in order to come into my facility, our suppliers have to be vaccinated and boosted. That is their requirement. And I had a couple that questioned it, and it's like, I'm sorry, that's the rule. We have to deal with it. But I'm learning that it's not as big of a change as what we first thought it was going to be. So providing proper decontamination, regular cleaning, using, we use a thing called HALT that is an antimicrobial that you spray down whatever the client has touched or that you have touched, and you allow it to dry. That tends to be very effective for us. And I can say that we've been able to have our wheelchair clinic starting since about, I think we took 3 months off when the pandemic first started and there were so many unknowns, but we've been able to have our clinic on a regular basis. And our administrators know what we're doing and the close proximity. So I feel like it's pretty easy to deal with the limitations. Again, I always choose seating based on what that client would best benefit from, not what's going to provide maybe less risk of getting sick, although we're taking every precaution so that doesn't happen, if that makes sense. Okay, next slide, please. So I'd like to thank the following manufacturers who helped me out by providing a lot of detailed information. Certified Adaptive was Scott Pickett. PRM was Todd Dinner. PINDOT was Mark Bisson, and Ride Design was Rich Salm. They were all very, very helpful. They were able to provide clarification when I wasn't understanding of something. And they made this presentation really possible. So next slide. If you have any questions, please feel free to email me. Just put ISS in the subject line, because technology, you can tell, isn't my friend most days. So I don't have access to the chat box.
I have it up for you. So I'll just go from the top down, some questions that came in during our presentation. So one of the first ones was, when would you decide to utilize 2 different manufacturers for one seating system, and why?
It will depend on the qualities of usually the seat that I need versus the back. If I want a more minimalist back for someone, but they need a lot of stability in their seat and they might have a huge incontinence issue, I might use a vinyl contour U seat with a Ride Design back. I might use a Ride Design seat for someone because I think that I might need to modify the cushion down the road as they grow or if their weight fluctuates. Those kind of technical reasons that I'm hoping I covered for you later on in the presentation.
Perfect, thank you. Next question was, why did you choose to not include Comfort Co. / True Shape?
Because True Shape, is that actually a simulation? From my understanding of that product, and I have limited exposure to that, that is a custom made cushion, but there isn't always a simulation.
Okay.
If you have more questions, email me that and I can do some research into that.
Yeah. Next one, how is Contour U unable to do trial fits when they were able to do so years ago? Did they have a change in process or company policy?
I'm not sure. I think right now it's a company policy because they can't bring cushions that have been sent out back into their plant. That would be a question for the manufacturer's rep. With a vinyl cushion, the vinyl covering is an integral part of their manufacturing process, so they can't produce a vinyl cushion without having that vinyl already in place, because that provides the parameters of the shape. So that, I know in the past, I used to have some trial fits using their silhouette as well as their naked, just not their Contour U. But I do know now with Contour U that it used to be if you had asked for a remake, you had to send back the original cushion that was delivered. And now, because they can't allow that back into their building because of germs, for lack of a better word, they're not requiring that either.
Perfect. One other question I see, how do you make sure there's enough space for the user in their custom seating system to account for various thicknesses of clothing and also maintaining room for respiratory functioning?
Well, I went through a phase of doing all shapes really, really snug, and to the point where people had trouble like getting a good deep breath. And now I've backed off most all manufacturers. So I sometimes still mold that way, but I will ask for a loose fit where the manufacturer can extrapolate and add a little bit of literally breathing space around it. So they just make that shape a little bit bigger, and that gives them a little more shape or a little more space within the shape. In terms of clothing, you know, I work in kind of a ideal world. I don't have to be accountable for my billing because it's all included in their cost of care. They live residentially with us. We use ponchos, so I don't have to worry about big puffy winter coats. For those families that still want to use those, I do some education with the families to show why a different style jacket might be better. And when I deal with the people who buy them the clothes, so we don't have, you know, the great big giant baggy jeans on some of our guys that used to be in style and would just add a lot of extra space in the mold.
Awesome. It looks like there's a few more questions, but since we are at our cutoff time, I'm going to announce the CEU code first. And then if people want to hang around, I'm sure Jill might be able to answer those last couple of questions. So I'm putting it in the chat right now, but our CEU code for this session is TZF1GV.
And again, I apologize for the technical issues and the dogs barking. What else can go wrong right now?
We're making it work.
So yeah, I appreciate all of you guys' help to make this work.
Yeah. Looks like one of the other questions was, do you prefer molding the rear of the seat with a posterior pelvic wall like ride versus leaving the rear of the seat open, like with pin dot being open to the rear?
It depends on the person. If it's a kiddo, I'm going to want to leave it more open. Keep in mind that that's the difference in their manufacturing and their whole product design, that Ride Design, it often offloads the cushions And they have what they refer to, I think, as the cantle. So that rear section kind of behind the meaty tissue on each side of the buttocks, that's an amazing weight-bearing surface that they can benefit from. If I do an open to the rear seat cushion, I'm going to use a back tongue to try to get that posterior pelvic support that they need, because I always want to make sure the posterior pelvis is fully supported. I'll just get it from the back instead of the seat.
Awesome. It looks like there were a few other questions in the chat, but I think other participants kind of answered people's questions and then some comments. So I think we can wrap up. And then if anyone has any further questions, it looks like Jill's contact information is right on the slide right there. So you guys all have the CEU code and you can go fill out your survey now.
Thank you so much.
Yeah. Thank you everyone for joining in.